Hello, in this tutorial we're going to speak about the classifications of worms. In the classification of worms, you have three major classifications. The first one is the nematodes. Is it clear? The second one is the cestodes, and then the third one is the trematodes. Is it clear? So this classification of worms is mainly based on the classifications of the pathogenic worms. The nematodes are also the round worms. Is it clear? Generally, that's how you can term them, round worms. The cestodes are the tapeworms. Is it clear? The worms that are resembling like the tip. The tapeworms are the cestode, and the trematodes are the flat worms. Is it clear? Now, among the nematodes, you're going to have one, you have Ascaris lumbricoides. You're going to have Ancylostoma duodenale, Ancylostoma duodenale, or it is still called Necator americanus. Is it clear? Americanus. It penetrates through the skin, and then its life cycle is going to enter the bloodstream and then end and then stop at the gastrointestinal tract. For Ascaris lumbricoides, the life cycle is that it's going you take it through a fecal-oral route, and then it passes through the sesame secretion into the lungs, and then it goes back to the GI tract. So that is for the Ancylostoma and Necator americanus. They are the same thing. Necator americanus is just the new name. We have also the Strongyloides. Is it clear? Strongyloides is most of the time affecting immunosuppressed patients. Is it clear? We have the filariasis. Is it clear? The filaria classes. Among the filaria, you have the first one, which is Wuchereria bancrofti. Is it clear? The Wuchereria bancrofti, which is the one that causes elephantiasis or any cause of lymphedema, obstruction of the lymphatic tract. Is it clear? So it's one of the major causes of a lymphatic. When you have lymphedema, you have also lymphatic obstructions. So lymphatic obstructions resulting to lymphedema, resulting to elephantiasis, and also resulting to a lymphatic ulcer. This is Wuchereria bancrofti. That's the major causes in that. Is it clear? And it is mostly transmitted by a fly. Is it clear? It is transmitted by the fly. Is it clear? Not the tsetse fly, but in this case, it's much more transmitted by a mosquito, and that mosquito is Aedes mosquito. It is not the female Anopheles mosquito like in a Plasmodium falciparum. It is transmitted in this case instead by the Aedes mosquito. Now, after the Wuchereria bancrofti, still among the filaria family, we have the lower. Is it clear? Lower is still transmitted by a fly, but it's much more going to affect at the level of the eyes. Is it clear? So you have a worm inside the eye. Is it clear? And if it is not managed, you're going to have vision impairment. The next one, we are going to have Onchocerca volvulus, which is also river blindness. Is it clear? Onchocerca volvulus. Is it clear? Now, this Onchocerca volvulus are treated with the affection of the eye and also the central nervous system. Is it clear? That's why, and this is going to be transmitted by the fly. The fly here is the black fly. Is it clear? That's the transmission of the filariasis, transmission by the black fly. And this Onchocerca volvulus results to onchocerciasis, which is river blindness. So most of the time, the people that are located to the river where there is this onchocerca, they are going to become blind. And it also affects the central nervous system by resulting to epilepsy. So it can result to what is called river blindness, and can also result to epilepsy. That is why patients that are located at the level of the BAM region, patients that are located at the level of the BAM localities usually have epilepsy, because there is a river there that is a hybrid for the Onchocerca volvulus. Now, after the early on filariasis, you have other like the Enterobius vermicularis. Is it Nematodes vermicularis, which is also fecal-oral, just like Ascaris lumbricoides. But the life cycle is not going to involve the bloodstream. It's not going to move through the bloodstream. It's just going to stay at the level of the GI tract, and it's resulting much more to infection in children, where children are going to scratch at the level of the anus, and then they are going to retake in their feces into their mouth, resulting to more contamination after the X has been transferred to their fingers after they are scratched. Is it clear? That is for Enterobius vermicularis. Now, those are the classification involved in the nematodes. The next one, we have the cestode. In the cestode, we have the Taenia family, like the Taenia saginata. The cestodes. Is it clear? Now we continue with the next one, which is the cestode or the cestoda. In the cestodes, you have the first one, the Taenia family. And now, among the Taenia family, you have the Taenia saginata. Is it clear? So, Taenia saginata is transmitted from